Male pattern baldness is a common condition that affects millions of men worldwide. It is one of the most prevalent forms of hair loss, impacting men of various ages and backgrounds. It is characterized by hair loss on the scalp, typically in a specific pattern, often starting with a receding hairline and thinning at the crown. This essay will delve into the causes, types, risk factors, and preventive measures associated with male pattern baldness, providing a comprehensive understanding of the condition. Hair loss can be a natural part of aging, but for many men, it occurs much earlier, sometimes even in their 20s or 30s. This can lead to emotional distress and significantly impact self-esteem, affecting personal and professional lives. Understanding the science behind male pattern baldness is crucial for managing the condition effectively, including the role of hormones and hair follicle sensitivity. While genetics plays a significant role, other factors such as hormonal changes, lifestyle, and environmental influences also contribute to this condition. By exploring these factors, men can make informed decisions about their hair health, seeking appropriate treatments, and adopting preventive measures to manage hair loss effectively. Male pattern baldness typically follows predictable patterns, making it easily recognizable. The most common pattern is a receding hairline, often starting at the temples. This recession gradually progresses, forming an M shape. Another typical pattern involves hair thinning at the crown of the head. This thinning can spread outward, eventually leading to complete baldness on the top of the scalp. It's important to note that not all hair loss is male pattern baldness. Other conditions like alopecia areata can cause hair loss in different patterns. If you notice sudden or patchy hair loss, consult a dermatologist for proper diagnosis. The primary culprit behind male pattern baldness is a hormone called dihydrotestosterone, or DHT. DHT is a derivative of testosterone, the male sex hormone. In genetically predisposed individuals, DHT miniaturizes hair follicles. This miniaturization process shortens the hair growth cycle, leading to thinner, shorter, and lighter hair. Over time, the follicles may stop producing hair altogether. While genetics plays a dominant role, other factors can exacerbate hair loss. These include stress, poor diet, certain medications, and underlying medical conditions. Section 4. Risk factors for male pattern baldness. Who is more likely? While male pattern baldness can affect any man, certain factors increase the risk. Age is a significant factor, as hair loss becomes more common with advancing age. Family history is another crucial determinant. If you have close male relatives with male pattern baldness, your chances of experiencing it increase significantly. Ethnicity also plays a role, with Caucasian men being more susceptible than other ethnicities. Other risk factors include certain medical conditions like prostate cancer and diabetes. Section 5. Prevention and precautions. Taking control of your hair health. While you can't completely prevent male pattern baldness, certain measures can help slow down its progression and promote overall hair health. Maintaining a balanced diet rich in essential vitamins and minerals is crucial for keeping your hair strong and healthy. Additionally, managing stress through regular exercise, meditation, or other relaxation techniques can be highly beneficial for your hair. Some medications like finasteride and minoxidil have shown effectiveness in slowing hair loss and even promoting hair regrowth in some cases. It's essential to consult with a dermatologist or trichologist to determine the best course of action for your specific situation and hair type. They can assess your hair loss pattern, identify any underlying causes, and recommend the most appropriate treatments tailored to your needs. Section 6. Conclusion. Embracing hair loss and seeking solutions. Male pattern baldness is a common concern for many men, but it's essential to remember that it's a natural process that many go through. While genetics plays a significant role, lifestyle modifications and medical interventions can help manage the condition. Early detection is key to finding effective solutions. If you notice excessive hair loss, don't hesitate to seek professional help. Consulting a healthcare provider can provide clarity and direction. Dermatologists and trichologists can offer personalized advice and treatment options tailored to your needs. They can guide you through various available treatments. Remember, hair loss doesn't define you. Your confidence and self-worth come from within. Embrace your individuality, and if you choose to explore treatment options, do so with a positive and informed mindset. Stay confident and make choices that make you feel good about yourself.